Then we'll talk a little bit about the difference between Alzheimer's and dementia. I get that question a whole lot. We'll talk about highlights in early detection and diagnosis, some of the latest advances in clinical trials and treatments and lifestyle interventions. And then towards the end, we're going to talk about resources that the Alzheimer's Association has available. So first of all, just to give you, just a few statistics. Right now in the United States, there are about 5.7 million Americans who are living with Alzheimer's disease. That's age 65 and older, so that doesn't count the people who have what we call early onset Alzheimer's disease, which are people who are diagnosed under the age of 65. We also have about 3 times that, about 16 million Americans who are providing unpaid care for their loved ones or family members. It is the 6th leading cause of death in the United States. And then when you look at Alabama, it's also the 6th leading cause of death in Alabama. One of the things you can see on here that is usually the statistic that makes everybody's jaw drop was that Alabama actually has the highest death rate from Alzheimer's disease. And typically we've been in the top 5 for the last several years, and a lot of the other states are in the top 5 as well. And people always say, gosh, why is that? And, what the researchers have told me kind of, and what I've read is just, there are a lot of comorbidities that we have in the South, and with diabetes and heart disease and things that, put people at higher risk for mild cognitive development and dementia. So in Alabama, we have over 96,000 people who are living with Alzheimer's over the age of 65, and we have about 306,000 unpaid caregivers in the state. So just a little about the association. The association is a worldwide voluntary health organization that really is totally dedicated to Alzheimer's care, support, and research. And our, mission and vision is to create a world without Alzheimer's and all other dementia. And we do that through accelerating global research, which I'll talk a lot about today, driving risk reduction and early detection, and then also just offering really quality care and support. So just to level set a little bit, a lot of people use the words dementia and Alzheimer's interchangeably, and I have lots of people ask me all the time, well, really, what's the difference? And so if you look at the, you can see on the slide here, dementia is kind of like it's the umbrella. So actually, dementia is the symptom, and it can be caused by several different things. Alzheimer's is the most common cause of dementia. You can see there's vascular dementia, Lewy bodies, frontal temporal. You may have heard of people with Parkinson's who develop dementia as well. So, lots of different things that can cause dementia, but Alzheimer's is the most common. So, just as an analogy, you can kind of think of, pain is actually a symptom. So, pain would be that umbrella, and pain can be caused by lots of different things. It could be that, you've had surgery, or it could be you broke a bone, or you got burned, or you've got a headache or a toothache, and so again, dementia is just the symptom. And dementia really is, it's not just one thing. It's not just memory loss. It's a collection of symptoms that are related to cognitive decline. And so some of those can be, memory, some are behavioral changes, and some of them, are due to biological changes in the brain that we're going to talk about. Again, I said Alzheimer's is the most common cause of dementia, and we are finding that lots of dementia, though, about 50%, actually may be some mixed dementia. So maybe it's Alzheimer's and also some vascular dementia. So Alzheimer's dementia really is it's a degenerative brain disease. Again, it's the most common form of dementia. It is a continuum that, begins before symptoms actually occur, and it worsens over time. Like I said, it causes memory loss, but, not just memory loss. It may be that it's really things that affect your activities of daily living. And so, of course, it can be forgetting, who people are and names and things like that. It can also be things that, used to you had no problem doing, maybe like counting out change or following a recipe, and now you're just not able, to do some simple task that you were, really good at, before. Sometimes it's, just not remembering how to do something, a simple task anymore. I talked with a family actually just this week, and she was at a store, she got lost in the parking lot, and then she didn't know what to do with her phone. She had her phone there, but she just didn't remember how to turn it on, how to dial, how to use it. I've worked with a family before whose father was, out on his front porch. It was a cold night, and he just couldn't figure out how to open the door. So just a simple task like that. And he ended up, sleeping on the porch that night just because he couldn't figure out how to do that. So again, it's more than just memory loss. It is memory loss, but it's a collection of things that really affect your daily living activities. So we talked about it being a continuum. And so, when we're born, most of us start off really cognitively unimpaired. And then there's this continuum. And the next stage would be mild cognitive impairment, or MCI. And, this is things that don't really affect your activities of daily living as much, So it's still, you can go through your day, but you are having some cognitive decline. So some people stop right there at that stage of MCI. So just because you get into MCI does not mean you're going to go on to develop dementia. But what we do know is that for someone who has mild, moderate, or severe dementia, they have passed through that MCI phase. And you'll hear me talk about in a few minutes too, just trying to reduce the risk of developing MCI, which in turn is going to help us prevent cases of dementia. Because we know that if you don't get into that phase of MCI, then you're not going to pass into the phases, go on further to develop get into those dementia phases. So just to talk a little bit about Alzheimer's disease, this is Dr. Alois Alzheimer's and his patient, I'm probably not going to say this right, but Auguste Dieter. This was back in 1906, and really it was kind of a time of a scientific revolution, because it was when microscopes were really coming into play. And so upon her death, he was actually able to look at her brain tissue under the microscope. And what he found were really are still the three hallmarks of Alzheimer's disease today. So one of them were these beta amyloid plaques that really kind of attack those neurons. The other were what we call tau tangles. Tau is actually, something that we have in our brain, but the way I have had it described to me was that, if you think about tau like railroad tracks, and, as they can transport, they can do their job, but if those railroad tracks get all tangled up, then they're not able to carry out their function anymore. So these taus get tangled up, or this tau gets tangled up. And then the third hallmark is brain atrophy, or shrinkage of the brain. So you can see there, the right side is someone with advanced Alzheimer's, and you can see how significantly smaller someone with advanced Alzheimer's brain is than a healthy brain. Just to kind of give you just an extra little side note, up until honestly I think it was about 16, 17 years ago, the only way people could officially diagnose Alzheimer's was upon autopsy, where they could do just, like he did here, and looking at the brain tissue, under the microscope, like I said, upon autopsy. But about 16, 17 years ago, actually, or when PET scans, and you'll see me talking about those again in a few minutes, but PET scans and some and spinal fluid were able to actually tell if, to diagnose Alzheimer's disease. Now that's, expensive and invasive, testing. It's not anything super simple. But one of the things I'm going to talk about is how close, and some studies that are really promising, just showing how a simple blood test might be able to diagnose Alzheimer's. So another question that we get, a lot is just, well, what impacts my risk? What puts someone at a higher risk for developing Alzheimer's? And there are some things that we just cannot change. We have no control over. One of those is age. And if you don't hear anything that I say today other than that Alzheimer's is not a normal part of aging, please remember that. So it is not normal, a normal part of aging. However, age is the greatest risk factor, and that is simply because, the longer that someone lives, the higher, chance that they may develop that. Also, just looking at that at age, women are at a greater risk of developing Alzheimer's than men are, typically because women, tend to live longer than men. Looking at genetics, there are, there are times that Alzheimer's disease can run in your family, and there are different genes and that kind of thing. I told you that I have that family history as well, and nothing I can do about that. Your race and ethnicity, we know that African Americans are are twice as likely to develop Alzheimer's disease as white Americans. We know that Hispanic Latinos are 1.5 times as likely to develop Alzheimer's disease. We don't know why that is, but we just know that that's what the data shows. So, those are some things that we cannot change. Some of the things that, though, we can change are what we call these modifiable risk factors. So looking at lifestyle factors, your cardiovascular health, your exercise and physical activity, your diet, your sleep, all those things that we hear all the time that we should do, and, things that we know can, help promote a healthy lifestyle. But looking at, our staying cognitively engaged, and what research is showing, I think I have a slide on this a little bit later, but what research is showing is that probably a treatment for Alzheimer's disease is probably going to be a joint type therapy, which, we'll probably be looking at some of these modifiable lifestyle factors, as well as, some type of therapeutic. Just talked about that. So just to talk a little bit about research funding, and one of the things that the association really has as one of its large pillars is advocacy. And so this slide actually shows the increase in Alzheimer's disease research funding that Congress gives to the NIH every year. And so if you can look back, and this slide actually is a little bit out of date, as of 2021, it's actually at $3.1 billion that NIH is receiving every year. But you can tell that, just in the past 10 years, it's gone up tremendously. So from, around $450 million a year to now we're at the $3.1 billion. We actually just had our National Advocacy Forum, which was virtual this year, but we had it last month. And so we met with all of the, all of our congressional offices and asked actually for an additional $289 million increase to be added on to that $3.1 billion. So hopefully at the end of the year, we will be, close to $3.5 billion that NIH is getting for Alzheimer's research. And again, that's coming from Congress, but we have our AIM is our advocacy arm of the association. It stands for Alzheimer's Impact Movement. And so we really use the voice of volunteers from all across the country to help educate our congressional members and their staffers on the importance of Alzheimer's research, and just really that the public health crisis that Alzheimer's disease really is. So we advocate to Congress to increase research funding, but we also, as an association, we are able to fund a lot of Alzheimer's research, and we are able to do that, globally. So it's a fantastic thing that the NIH is receiving, or Congress is giving all that money. But we know that that has to stay in the United States, and fortunately, we are able to actually, like I said, fund research that's going on all over the world. So right now, you can see we've got over $208 million of active research grants in over 31 countries around the world. Because I know if you are like me, we don't care where the treatment and cure comes from, just as long as it comes. And this really is an exciting time in research. There are so many things going on. One of the things, and again, I'm not an expert on this drug, but something you may have seen actually just in the past couple of weeks in the news was the approval, the FDA approval of Adukanyumab, and actually the brand name of that is going to be Aduhelm. I can't speak to the efficacy and safety and all of Adukanyumab, but what I can tell you is it is an anti-amyloid therapy. And so, one of those hallmarks we know of Alzheimer's disease are the beta amyloid plaques. And so this type drug, Adukanyumab, is meant to try to, for lack of a better word, attack that amyloid plaque around those neurons. And what we are finding is actually that people may have those hallmarks, those amyloid beta plaques and those tau tangles in their brain up to 20 years before someone, before they cause enough damage for people to start showing those symptoms of dementia. And I'll kind of put all this together here in a couple more slides down the road, but just remember that, so that Adukanyumab, and again, it is the first therapeutic, first medicine ever that has been approved that can, would change the progression of the disease. It's been, almost 20 years since there were any kind of drugs that were approved just to kind of help treat some of those symptoms. But this drug actually is the first of its kind in that it could actually change the course of the disease. And, one of the things that I just think is super exciting about this is just that since this is the first of its kind, not that this is the end-all be-all and there's still, lots of work that needs to be done in research, but just looking at other diseases when a drug like this, a first of its kind, is approved, a lot of times that really just invigorates the whole space around research in that disease. And so I'm just super hopeful, and I'm just very excited, that we have this approval. So one of the things that the association does each year is hold its Alzheimer's Association International Conference, or AAIC. And it really is the largest convening of scientists who are dedicated to Alzheimer's and dementia research. I was fortunate to get to attend about 3 years ago when it was being held in Chicago. And there are typically between about 5,000 and 6,000 scientists who are there, and which, when you're sitting in that room surrounded by, 5,000 people that are all searching for the same, that same treatment and that same cure, it was just very, very powerful. Of course, with the pandemic this past year, we had to kind of shift all of our programs, all of our education programs, support groups, and advocacy efforts, as well as the AAIC conference, we took virtually instead of being in person. So it was supposed to be in the Netherlands, but again, because of COVID, we did it virtual. And what we found, though, that there was a little bit of a silver lining to having it virtual, in that instead of 5,000 to 6,000 participants, we actually had 33,000 registrants from over 160 countries in the world. So just think that is phenomenal. And we've learned throughout this past year and a half to, as we slowly move back into in-person programming, we know that there is a great need for that virtual component as well. So going forward, we will have a hybrid of virtual programs as well as in-person. So speaking of that, the AAIC conference this year is held next July will be next month. It's going to be in person in Denver, Colorado, but also it's going to be online. And so anyone is able to register for that. I'll give you our website here in just a few minutes towards the end of the presentation, but anyone's able to register for it and be able, it's totally free. You can watch, all the different sessions. It typically goes on for about 5 days, so it is a jam-packed conference, but lots of good information. So just some of the highlights from last year's AAIC. One of the, like I said, the biggest topic, I guess, that was talked about there were these hunt for biomarkers. And so, like I talked about earlier, up until, about 16 years ago, you couldn't diagnose Alzheimer's disease in the living. But then we were able to do, like I said, the PET scans and looking at spinal fluids and things like that so that we could diagnose it in the living. Well, at the conference last year, there were several studies that really looked at how promising this blood test that they had been testing could be. And the blood test is, it detects a part of tau that's called p-tau217, which is really specific to Alzheimer's. So, the impact that something like this could have, just to have something that is a non-invasive, not expensive, test that we would be able to go to the doctor and get just on a, just like we get a cholesterol screening, that's just kind of a part of our annual, wellness exam, really. And so if we're able to come up with a test like this, that's that simple, that inexpensive, and if research is showing that we may have Alzheimer's in our brain up to 20 years before we actually start showing symptoms of dementia. So if we can get a blood test like this, something simple, and then find out that, okay, yes, maybe we do have some amyloid beta plaques, we do have some tau tangles already, but they're not causing those dementia symptoms yet. And then if there are therapeutics like Adukanyumab or something that we can then begin taking to help eliminate maybe some of that beta amyloid before it starts causing the damage in the brain, then you can just see what a great impact that could have overall, and how exciting that would be. So again, going back to the analogy of cholesterol screening. So if you go to the doctor and your cholesterol's high, that's a biomarker for heart disease, and probably what the doctor is going to tell you is you need to change some of your lifestyle habits and exercise and diet and things like that, and then probably he's going to put you on some type of therapeutic as well. So a combination therapy. And again, that's kind of what they are thinking, that a futures of Alzheimer's therapy will likely include both lifestyle interventions as well as medicines. So as we talked about Adukanyumab, that it was just approved by the FDA. Gosh, I think it was June 7th. Actually, was the day that it was announced. But just this slide kind of just shows you how many other therapeutics are in clinical trials right now. So, and you can see, they've got 3 phases to go through, and not all of these are therapeutics that would change the progression of the disease or the course of the disease. Some of them are address some of the things that go along with dementia. We know there's a lot of agitation and aggression sometimes with people with dementia, a lot of sleep disturbances, looking at insomnia, psychosis and hallucinations and delusions, and then just some apathy, just lack of appropriate emotional responses. So again, just the fact that there are, I think it's just comforting to know there are so many trials in the pipeline, and again, they're kind of focusing on Alzheimer's and dementia from all different angles, from course, from the disease progression, all the way just to some of the symptoms. So a couple of years ago, actually, year before last, I guess it was, at the AAIC conference, one of the big studies that came out and was announced then was what is called the Sprint Mind study. And this was the first study that actually just concretely was something that we now know can reduce the risk for MCI. So, I talked about earlier that, that phase of mild cognitive impairment, and that anyone that if we can prevent people from getting into that mild cognitive impairment phase, then we are preventing them from getting into the dementia phases as well, since we know they have to pass through that MCI phase. So the Sprint Mind study, you can see there was a 19% reduction for MCI and a 17% reduction risk for dementia. Well, what this study looked at was blood pressure and really intense treatment and intervention for treating high blood pressure. And I had always heard, yeah, well, if it's 120 over 80, I'd always heard, oh, watch that bottom number. That's that bottom number that you need to keep an eye on. Well, this study actually was looking at that top number, so that systolic number. And in the study, there were two different groups of people. One group, they kept their blood pressure controlled to 120 systolic and below. The other group, they kept it controlled at 140 systolic and below. Well, the findings were so significant that they ended up having to stop the study early because they said it would have been unethical to continue on with the study because they knew how much of a difference it would make between the group that they didn't want to keep that group at 140 and below because they knew how much of a difference it would mean if they were treated at 120 and below as well. So, so again, just that it was just a huge study that really showed really the connection between heart health and brain health that we're learning about. Again, just like I said, we're learning that what's good for the heart is good for the brain. Lots of the different things that we already know that we need to do to keep our heart healthy. We're learning that also keeps our brain healthy. So again, looking at that, diet, exercise, sleeping habits, things like that. So I talked about these modifiable risk factors and looking at these lifestyle risk factors. One of the things that the Alzheimer's Association is doing as well is we are conducting a clinical trial called the U.S. Pointer Study. And this is a 2-year study. There are 2,000 participants at, you can see here, at 5 different places around the country, and they are still taking enrollment, right now as we speak. And really what this is they're going to divide these participants up into 2 groups as well. So one will be a self-guided lifestyle intervention, and one is going to be more of a really structured lifestyle intervention. So, if you just think about like maybe with a coach, somebody who's really walking you through everything step by step. And what they're going to look at for these 2 years is their physical activity, their diet and nutrition, their cognitive stimulation, and then as well as, like I talked about, different health coaching. So what we think that this is going to, yield at the end of the 2-year study is just some really valuable data to show, to look at and see, do these modifiable lifestyle changes, do they have a huge risk reduction in Alzheimer's and dementia? So I think it'll be super, super valuable at the end. And just to let you know, this U.S. Pointer study that we are doing here is part of a global study called the Worldwide Finger Study. And this here just shows, some different countries that a study similar to the U.S. Pointer study is being done around the world. So again, it's going to be, tons of really good data, I think. And so, looking at what we want to do, of course, is change the trajectory of Alzheimer's disease. And so this slide is a little bit, it predates the June 7th approval, FDA approval of Adukanyumab, but, just looking here, if we can develop a treatment by 2025, so, just 4 years away, that delays the onset of Alzheimer's by just 5 years, then you can see that by the year 2050, almost 6 million people who would have been expected to develop Alzheimer's would not develop that. So on that slide you saw where it showed how many different clinical trials were going on in Alzheimer's and dementia research. Those trials are not possible and can't be successful unless they have participants. One of the things that the association offers is a thing called Trial Match. And so if you kind of want to think of it as kind of like Match.com, but for research trials, you can go on our website and go to the Trial Match tab. It's just a quick, about a 10-question survey that you can answer. They are looking for all sorts of people from across the spectrum. So people who may have a diagnosis, maybe people who have a family history but have no symptoms or diagnosis now. They need caregivers. They need just healthy volunteers. So really, people from all across the scope. And what they do, once you answer that 10-question survey, it will then tell you if you are qualified, based on your answers, to participate in any clinical trial that's near you, or it may be one that's online that you can participate in. It does not send your information to the trial studies and to those researchers. It simply gives you the information of the ones that you qualify for, and then you are able to it gives you their contact information, and then you are able to contact that study if it's something that you want to learn more about or that you want to sign up for. But I would highly encourage everyone to go on Trial Match, again, because all of those clinical trials are fantastic, but if we don't have the participants in them, they're not going to give us much useful data. Other thing I just want to tell you about is, it's fairly new of the association, but it's our new Science Hub app. And so this is something you can download on your smartphone. It's totally free, and it is updated, just about on the daily of anything that is going on in the research world in Alzheimer's and dementia. So, you can set it up just to kind of get alerts. You can go in and search for different topics, and it bring up different studies and things. So it's just a wealth of, information right there at your fingertips, in real time. So I would love for you all to go on our website and download that. Just a little bit about the association. I am a very visual person, and so just excuse the art on this because it's something I did, but it makes it easier, I think, for me to explain kind of what the association, the work that we do. So, if you look at the left side of that screen, when a family is facing Alzheimer's, it really is like they are pushing a boulder up a mountain. And so the association wants to be there to offer, care and support services to help push that boulder up the mountain. And you can see, some of those services are one-on-one, some of them are one-to-few. Things are, like we have a 24/7 helpline that I'll talk about in a minute that offers care consultations. We have support groups, we have education programs, we have early stage programs, and then we do a lot of information and referrals. On the right side of this the slide is the work that the association does for the masses. And so, not only do we want to be there to help walk alongside families who are going through Alzheimer's today, but we want to chop that mountain down, so that there's not that mountain of Alzheimer's anymore. And so some of the work that we do with that is through research that I've talked a lot about today, both funding research as well as doing clinical trials like the U.S. Pointer study. Another is through policy work, both on the federal and on the state side. One of the things, again, like that we always advocate for every year on the federal level is increased research funding to the NIH. And then we do things on the state level as well. And then the bottom thing down there is just regulations and health systems. So we really excuse me, want to work with health systems to, to make their hospitals more dementia-friendly, to really educate primary care physicians and their staff, in early detection and diagnosis and risk reduction and things like that. So, so again, that's kind of just, the different angles that the association comes to address Alzheimer's. So I talked about our 24/7 helpline. This is something that I think is just one of our greatest assets. Of course, like it says in the name, it's answered 24/7, 365 days a year. It is staffed by master's level clinicians who are there to, to help with care planning, with crisis intervention, with just suggestions, with disease education, or it may just be, just a listening, supportive ear that somebody needs. But they are there totally free of charge, anytime, day or night, and they are able to offer services in actually over 200 languages, which I always thought was just amazing. So please help us, in spreading that number out there. We know that we have lots of calls to it, but we know there are lots of other people who need it, who just do not know it exists. So it's that 1-800-372-3900. We also offer support groups around the state as well as virtually. We are just now going back to in-person support groups, but again, like I said, we kind of noticed a little bit of a silver lining in virtual programs in that it allows people who weren't able to get out, either that maybe there wasn't an in-person support group in their community, or maybe they just they didn't have someone to help them with respite, and so they couldn't leave their loved one at home. If there were current caregivers. So we are going to continue also to have virtual groups as well. We also do a lot of education programs. Again, we are just now starting to go back to doing in-person, but we also have them where we can do virtual, that are live virtual programs. We also have all of these topics just kind of an on-demand on our website. That's a pre-recorded thing you can go and watch at any time. We have lots of different, probably these are just a few, but probably about 20 different topics. So anything from just basic Alzheimer's 101, so just understanding Alzheimer's and dementia, to knowing the 10 warning signs, to things that are really more specific. So effective communication strategies, understanding and responding to dementia-related behaviors, legal and financial planning. And a lot of these are designed for caregivers. We also do have some professional training. So, and most of this is online, and it's for first responders, for long-term care facilities. We have a CME for physicians that is available online as well. So lots of different education programs. And then also we have what we call a community resource finder, which we have kind of in partnership with AARP. So it just has lots of different community resources on there. People are able to, different companies and services are able to go in and put their information into our community resource finder. So it's just something that families can go on and just search for resources in their area. And then also our helpline care consultants are able to help with community resources and information referral as well. So I want to give you to just, and I didn't put it on the screen, but our website is alz.org, and it is just chock full of information and resources. So both for family caregivers, for professional caregivers, for people with a diagnosis, lots and lots of different tools that are available on there. So please help us to, spread the awareness of that website and that it actually exists as well. And I can always be reached if you have any questions. My email is on the screen there. It's lholman@alz.org. I'd love to help you in any way I could. And with that, I guess we'll take questions if we have any.
All right. Well, while we wait to see if we have any additional questions, I do have a few.
Okay.
When you mentioned support groups, can you share some of the success stories you've seen during your time with the association as it was linked to giving people the support they needed through that group?
Sure. So, you know, support groups really offer just such a valuable resource to people to families who are, you know, on this Alzheimer's journey. And I think it's, support groups can be so beneficial because, you know, one, you're sitting next to people who are walking in your shoes or have walked in your shoes. And it's people who are at different phases. And so they're able to give you really, you know, valuable insight into maybe what worked for them, you know, with their loved one, or to try to, you know, let people know, well, this is probably kind of what you can expect next. But, you know, I think I hear from families that have not been to support groups and who did not know the association existed and had not reached out for help, that they have said, you know, I just feel like I'm on an island. I just felt like I was going through this totally by myself. And so I think those support groups are able, you know, to give them that connection with people who actually, you know, are going through the exact same thing they are, and to know that they're not going through it alone.
If an individual has an aging parent, loved one, or other family member that they might suspect is showing signs of dementia or Alzheimer's, there are so many resources, but there are also so many resources. And in a world where we're so quick to kind of be like, well, let me Google it or see if this really is what it is, would you suggest to those individuals that they contact the helpline first? Would they see their physician and kind of speak on it then? Would they contact you all directly? Where would they kind of start?
Where would they go first? So we always recommend contacting your PCP, so your primary care physician first. We do say too, though, if you have concerns and you know you go and you don't get the response that you know that you're looking for, we say you may need to get a second opinion, to somebody who will take your concerns more seriously, I guess. So, but yes, so we always recommend starting with your PCP. Of course, you can call our helpline, if you want to just talk through some of the things that you're seeing and, the symptoms you're seeing with one of our care consultants. And again, that's exactly what they're there for. And they will probably encourage, or not that they probably, but they would encourage you as well to see your PCP.
And one last question. Are there opportunities for individuals to volunteer and support the association that go, of course, beyond making a donation or like a one-off and supporting a walk or something?
Oh, absolutely. So I will tell you, we are, as a chapter, we have 6 staff members. So we are a small, a small chapter. I am actually the only one in programs in the state. And so for all of our work that covers all of our pillars through development and the walks, through our programs, care and support programs, through our advocacy efforts, volunteers are the heartbeat of the association. And we could not do what we do without our volunteers. And so we have opportunities, again, like I said, you like fundraising and, helping to plan our Walk to End Alzheimer's, which is our signature event that happens. We'll have 8 of those across the state this fall. If you want to participate and volunteer in our care and support programs, all of our support group facilitators are volunteers. We have community educators who are volunteers. We have community representatives who really are just kind of the face of the organization in communities all across the state, just helping us to try to get these resources out there, building community partners, things like that. And then also for our advocacy, programs, we utilize volunteers all the time, and they really are what make an impact when we're talking to our state leaders or our congressional leaders and trying to get them to implement these policy changes, that will help someone, a family, on the Alzheimer's journey. So we have, with advocacy volunteers, it's anything from just as simple as signing up to receive action alerts from our DC office, where they send a text to your phone and say, they really make it super easy. Click here to send a message to Senator Shelby about, to increase research funding for Alzheimer's disease. So it can be as simple as that to we have volunteers who, what we call our ambassadors, who year-round, they really are working to develop relationships and nurture and build the relationships with district staff members and, leaders down in or here in Montgomery, leaders in DC, for the state. And so we have a whole huge spectrum of ways people can get involved. And they can email me too about that. And then also on our website, the alz.org, there is a whole volunteer opportunities site too, or tab.
Thank you, Lisa.
Sure.
This concludes our program for today, but I want to thank Lisa for being here and thank you for watching. Please remember that you can refer back to the training and resources anytime on demand. Have a great day.